our mission is to accelerate the diagnosis of rare diseases. Today, rare disease patients and their doctors do not have a clear or organized understanding of their disease. They do not know how symptoms develop over time, the causations of those symptoms, or how to manage their symptoms. Without a way to record this sporadic information, it is very difficult for doctors and patients to pinpoint a diagnosis earlier on. This inefficiency results in an average diagnosis time of 7 years, during which patients are referred over and over around 14 times before reaching the right doctor. This means that every patient needs to keep track of all their appointments and explain their condition numerous times, which is tiresome, frustrating, and inefficient, because a lot of useful information is lost in translation effectively from referral to referral. Fueling this inefficiency is an underlying problem of lack of knowledge. This is largely because of the inefficient method being used to gather patient data today, either by sifting through clinical records or making patients fill out complicated medical forms. This lack of data also slows down drug development for rare diseases, which, although is not directly part of diagnosis, becomes crucial when patients are misdiagnosed or not treated correctly. The Diagnostics platform is trying to accelerate rare disease diagnosis in an encompassing way by creating a service for patients that is fueled by their data for their own benefit, as well as for the benefit of research and the undiagnosed. After talking to 64 rare disease patients, we have learned that the burden of rare diseases is not only about the slow process of diagnosis, but also how complicated it is to understand a rare disease and how it affects a patient, and how it affects the rest of the population. We provide patients with a way to monitor the development of their symptoms and overall condition over time with analytics created from their own data. They can input their mood and their activities every day, and our platform will show them a breakdown of the correlations between what they do and how they feel, what works and what doesn't, and also how this differs among a wider population of people experiencing the same symptoms. Beyond this, we have realized that building a platform that both diagnosed and undiagnosed patients consults for their own benefit creates even more opportunities. We can connect patients through our mentorship program so that undiagnosed patients can reach out to diagnosed patients of the same symptoms profile and ask questions. Also, we can separate the diagnosed patients from the undiagnosed one and compare. And from here, accelerate diagnosis by understanding the patterns, variables, and symptoms that create a match for a rare disease diagnosis. In terms of business model, we have two potential revenue streams, one long-term and one short-term. In the short term, while we're developing the app further and finding out what are the most valuable analytics for patients, we're planning to provide a freemium premium model where patients can access the platform free of charge, but need to unlock the added benefits and more advanced analytics for a monthly fee. There are 3.5 million rare disease patients in the UK. If we manage to charge 5% of that amount, something like £5 a month, we would have an annual revenue stream of around £10.5 million. In the long term, the breakthrough value the Rare Diagnostics platform will provide is to biotechnology and pharmaceutical companies who are focusing on investing in rare disease treatments today. Overall, the market for orphan drugs is expected to reach more than £200 billion by 2024. So far, we have spoken to Roche, Genentech, and Horizon Therapeutics, as well as Helix, all biotech companies currently developing drugs in the rare disease space. Right now, these companies turn to patient registries and online forums to ask and beg patients to submit their information for research, so that they can find a clear connection between pharmacological mode of action and pathobiology. We have the potential to completely change the way the pharmaceutical companies conduct research in this sense. Our data will be collected in real time every day to demonstrate a patient journey. We gather this information as a service to patients, so our onboarding and retention rates can be much higher than the current alternatives. Through benchmark analysis with competitors, we have estimated that per rare disease, once we have collected 150 different data points for a total of 300 rare disease patients, we can become a reliable and appealing resource for biotech companies. Onboarding rare disease patients, it can be a delicate matter because, as mentioned before, these patients are constantly bothered for their data for very little benefit. So we have spent 3 months conducting different experiments to figure out the best way to get the interest of patients and ultimately establish trust with them. With our experiments, we have understood that the best performing strategy is to go through patient organizations and gatekeepers within these groups, carefully explaining our idea and our intentions, and through building this relationship, basically infiltrate the rare disease patient market. So far, through this methodology, we have created partnerships with the Save Some Anti-ADS Foundation and the Choroideremia Foundation. We are working with them in a closed beta to onboard the patients within their community as our early adopters and test our value proposition.
Awareness about rare diseases is growing throughout corporations. However, we are the only ones providing data-driven insights to diagnosed and undiagnosed rare disease patients.
And by personal experience, and after having talked to many patients, we believe that this is a very strong value proposition for them.